participating in all of it today. But I always think of this meeting as, if anybody's looking for the best information, the best wisdom about implementing early childhood education policies, I always say this is the meeting to go to. So hopefully one day we will all be in the same room together and I can see many of your faces again in person. And I also want to, before I dive in, I also want to extend a thank you to people in this meeting and in this association, because it's been a really tough year and a half, more than a year and a half now. And the first people we really need to thank are the early childhood educators and providers who are holding down the fort, holding down the system. I think the second group I want to thank is people in this association, because you guys have also been holding down the fort in many ways and shouldering a lot of the burden that has been put on the system. So I want to thank you for your hard work. Okay, so we're here to talk about the workforce. So I was thinking about what, kind of how to open it up. And one of the things I remembered was that one of the last in-person professional gathering I attended before the pandemic was on March 9th, 2020. And that was the release of the Policy Profession Unifying Framework, which happened in Washington, DC. And I remember that even back then, even with the coronavirus kind of lurking in the background for a second, maybe for a few days, there was a sense of hope and momentum in the field, a sense that after decades of work by people like you, agency leaders and staff, policymakers and elected officials, researchers and advocates, we now have a blueprint that we can rally around. And even if we don't agree with every single detail in that framework, it can serve as a roadmap for the work that we all need to take on in order to advance the early care and education profession. But then, of course, the pandemic hit. And instead of focusing on the future, everybody was putting out fires every day that they see right in front of them. And at first, it was basically trying to keep programs afloat and early child educators safe and employed. And that really hasn't changed much in terms of what the crisis in front of us in terms of the workforce. And now the main challenge seems to be recruiting and retaining staff in a very competitive job market, so that early child education programs can ramp back up and just even survive. But in a way, I will also sort of submit to you that we never really lost momentum. If anything, the frustration and even anger felt by the field really fueled a sense of urgency and clamoring for change, not just back to the status quo, but toward a more transformative vision for an early childhood education system that is made up of early childhood educators who are diverse, competent, well-prepared, well-supported, and well-compensated. That vision is still there. People are still talking about it. We have not let the pandemic and the kind of economic troubles, especially the beginning of the pandemic, kind of like limit our vision for what we need to accomplish. If anything, it has added to that urgency, has added to that fire. So luckily, as we continue this work, we actually are presented with some opportunities ahead of us, right? So, policy profession still exists, and there are other recommendations, roadmaps, blueprints, whatever you want to call it, that many people have put out there during the pandemic as things that we need to do for the future. And I would just give a short plug, and I'll put a link in the chat later on about the Alliance for Early Success, our Build Stronger policy roadmap for childcare, which includes a big section on workforce. Of course, we are also keeping a watchful eye on the budget reconciliation process, the Build Back Better plan here in Washington, D.C. And what I've been told to always say when that comes to pass, that there will be additional resources, policy opportunities that will advance the workforce. And then finally, I think the past 20 months or so have also given us a lot of lessons from what I've been calling pandemic era policies, practices, and recommendations at both the state and national levels that did away with the doing away with the old way of doing things and trying to introduce a new way of doing things, especially when it comes to the workforce. So many of you have been part of those implementation efforts, part of those, putting out recommendations and ideas for what to do, how to do things in a different way. And some of the people that we're going to hear from today are going to share with you those policies, practices, and recommendations about what we can be doing for the to really advance in a more transformative way the profession of early childhood education. So with that, I am pleased to introduce to you our panelists for today. We have Dr. Caitlin McLean, Director of Multi-State and International Programs at the Center for the Study of Childcare Employment at UC Berkeley. We also have Dr. Kimberly Krzyzanowski, sorry, I was so good at the prep. Krzyzanowski, Executive Director of Office of Early Learning in the Delaware Department of Education. And then Taylor Dunn, Director of Watershed Advisors, but also formerly at the Early Childhood Education head at the Louisiana Department of Education. So with that, I'm going to turn it over to the panelists. And I think, Caitlin, you're going to get us started.
Great, thank you, Albert. Welcome, everybody. So what I'm going to be talking to you about today is how states can and are approaching support for the early care and education workforce, especially as it relates to compensation with American Rescue Plan and other relief funds. So just a little bit of context about my research center and what we do before I jump in. Our research center is entirely focused on the early educator workforce, birth to 5. So including childcare settings, not just limited to pre-K. And of course, we conduct research about those who care for and educate young children, as well as their working conditions. But we also propose policy solutions, really aimed at improving how we prepare, support, and reward these early educators. And so recently, we have focused our efforts on tools to support state leaders like yourselves in using federal relief and other funds, really, again, to support the workforce and especially for compensation. We know that the mostly women and many women of color who do this work have been risking their lives, the lives of their families to do this, and yet they continue to receive poverty level wages, often don't have access to health insurance or paid sick leave. And not surprisingly, we are at this moment of, a critical ongoing workforce shortage that has been crippling the field. Next slide, please. So, given this, our research center developed recommendations for how states can use American Rescue Plan dollars for the workforce. I'm going to drop these recommendations into the chat, and you can also see them on the slide here. So these recommendations are, of course, based on our own center's 20+ years of research and policy expertise. But we also engaged with state advocates intentionally and explicitly to really talk through what are the issues of trying to do this on the ground. And so we wanted to make sure that our recommendations were responsive to that. But I think it's important to understand kind of how are we approaching this? And really the foundation of our recommendations is our belief that it is absolutely critical to prioritize getting money directly to the workforce. There are so many important needs in the field. There are general program costs beyond personnel, of course. We know that parents are also looking for relief in their costs. But the fact is that we have been shortchanging our workforce for so long, and so many teachers are now saying, we can't continue to do this. And so we have got to make them a priority. Of course, we know that relief funding alone is not enough to make some of the long-term investments, radical reform that our system needs and that are outlined in the Alliance Build Stronger roadmap. But again, our recommendations are really around, at a minimum, we've got to make sure that there's this rapid relief to educators. Additionally, and kind of coming back to what Albert was saying before about lessons learned, what can we learn from this moment in time? It's our hope that by using relief funds in this way, we can help to kind of set a precedent for future investments to really say, compensation is not a nice to have. It's a must have. We have got to be investing in this always. And that it can become kind of a cornerstone of our public investment, not an optional use. And one of the great things about the American Rescue Plan is that it does provide multiple opportunities to address compensation and benefits, and the language is very clear that it's an appropriate use of the funds. So I want to make sure I have some time to talk about some actual examples, but just very briefly, I wanted to kind of talk a little bit about some of the recommendations. So the first two really highlight what we're saying is the what of the recommendations. So again, making sure that the workforce is getting paid, even if that's bonus payments, whatever it needs to be to recognize that educators need immediate financial relief. And two, again, recognizing that many educators don't have access to health insurance, don't have access to paid leave. These are two of many important benefits and supports that really ought to be prioritized during a pandemic. Some of the other recommendations are a little more around systems. So ensuring that you have a data collection system in place so that you can actually document the impact of these things, and that we can go forward and say, this worked or this didn't, and this is why we need this. And a couple of the other recommendations, I think it's 7 and it's small on my screen, sorry, 7 and 4 are really around equity. So we wanted to make sure that folks are attentive to the many existing inequities that have been built into our system. The fact that, programs in certain communities have less access to resources, less access to quality rating systems. And so this is an opportunity to really think about how do we support our entire system and kind of move away from that scarcity mindset of, well, we can only help some programs. So I'm happy to talk more about any of these recommendations in the breakout as that's helpful, but I want to move on and talk about some examples. So next slide, please. Thank you. So here's just 4 examples from some new research that our center is working on to really track, again, what are states doing to try to prioritize compensation with relief funds or other funding. And the first 3 examples here are really like different approaches to using grants to prioritize compensation. So with Connecticut, you have kind of the carrot approach of, if you use money for compensation, you can get some extra funds. Minnesota went at sort of a different route, saying we're actually going to require, if you get this grant, that you use a substantial portion of it, 70%, for compensation. I think there's folks from Minnesota on today, and I would just say, I think that's great that you're coming out so strong to say this is an incredibly important use of these funds. And then Arizona is kind of like in the middle here, where they have general stabilization grants that programs can apply for, can be used for a variety of things. But then they have also implemented a retention and recruitment grant specifically. So 100% of those funds have to be used for salaries, benefits, bonus incentives, that type of thing. And then just very quickly, I would highlight Washington as a really interesting and innovative example of addressing the need for access to healthcare. So what Washington is doing is basically for the next 1.5 years, they're covering healthcare premiums for childcare teachers who are getting access to healthcare through their state exchange. So that is really incredible for systems level thinking, but also understanding that even when you have access to health insurance, the cost burden of premiums can be prohibitive, especially again, when you're an early educator making often, minimum wage or barely above. And then next slide, please. So thank you all very much. Again, I'm very happy to talk more about any of these examples or really dig into the details in our later session.
Thanks, Caitlin. So I think next we're going to hear from Kimberly.
Thanks so much, Albert. Hi, everyone. Good afternoon. I'm going to talk a little bit about what Delaware has been struggling and continues to be challenged with, but also some light at the end of the horizon about some choices that we have been hoping to make and that we're going to be making to focus on the workforce. So a little bit about Delaware, if you're not as familiar with our state, we have a little less than 1 million people population, 3 counties, one of which houses our most urban county, and then the rest are what we would consider to be rural. We have 2 rural counties in the middle and then in the southern part of our state. I say all that because it paints the picture of the possibly the demographics or definitely the needs that we have for access to high quality early childhood in all of our counties. Our county that has our urban setting is most dense. It has the most providers, and it lessens as we go down the state. And by the way, you can drive through Delaware in about less than 2 hours from top to bottom. So that just gives you an idea of the size of it, but the need as well. So we have around, I'll say plus or minus around 5,000 people working in our workforce. I say plus or minus because, as we all know, we're losing people by the day to other careers that pay more. So our last workforce survey, that was our our numbers. So I'll say plus or minus, and that consists of teachers, assistant teachers, curriculum coordinators, and administrators. So it really does run the gamut. And when I'm talking about workforce, I'm talking about licensed childcare providers, birth through school age. This is not counting our pre-K or our K-12 colleagues. I'm just focusing today just on our licensed programs. Delaware has had some changes and some shifts in their qualifications over the years, but ultimately where we are right now is we require minimum qualifications in training, 120 hours of a training program that will allow you to work in a licensed childcare. We are moving towards looking at CDA, looking at how that articulates to AA and BA, but CDA is going to be our focus. We have many people, like I said, with those 120 hours. So through the pandemic, really thinking about how we can capitalize on some funds and some supports to take what people already have and turn that into a journey for them to obtain that CDA. During the past year and a half or 2 years during COVID, I wanted to give you all a little update on what we were doing. Obviously, like all states, we were talking about vaccine coordination, but through the ARA funds, we started to do something with stabilization grants. And that really was able to stabilize our childcare programs. Programs were able to apply for money and they could use that for a number of things. The majority of them use them for operational costs to cover payroll, but some programs, more than what we thought in the beginning, actually were looking at retention and recruitment bonuses. They saw that there was a decrease in the number of staff that were coming back after being ill or taking time off to care for family members, and they knew they had to not only recruit new staff in an interesting and innovative way, but also to retain the staff that they had. We also thought through ways to address some of the workforce issues with planning job fairs with our partners at the Department of Labor in Delaware, and we decided to have 4 specific early childhood job fairs. Some were successful, some were not as successful. Once again, when you're competing with Chick-fil-A and Walmart, who are paying $18 to $31 an hour, it's really hard to sell that to someone when they're looking at sort of the job right now versus a career. Our focus on our ARA funds have been on workforce, and we continue to have a strong commitment to ensuring that we are getting money into people's pockets, getting money into programs' pockets, and making sure that partnerships either thrive or are redesigned through this. We knew that through any sort of money out to people, we had to design intrusive supports, not intensive, but intrusive. And what I mean by intrusive is that we needed to make make sure that supports were coming to people and they didn't have to access them or find time out of their day. So really thinking through coaching, mentoring, working with administrators to think about how they could redesign their budget and their leadership approaches to the workforce is something that we have been implementing and are going to be scaling up. We knew that it didn't just matter about educational obtainment, but really career advisement and making sure people were understanding, rebranding this idea of early childhood in their lives, and that if they wanted to be a classroom teacher, that was fine. We want to support them, but also showing them different ways that they could change careers, but also work with young children. Our focus on our supports has been really rethinking some of the strategies that Caitlin was talking about around group benefits, really thinking about how we could, as a state, work with local or national organizations to think about group benefits, a focus on telehealth. We had many providers who were supporting their staff in having telehealth, focused on mental health questions and concerns, just having 5 or 10 or 15 minutes where they could talk to someone confidentially about all the things that were going on was a retention strategy. We also have been thinking for a number of years and are gaining some traction on a substitute pool. So many people want to have higher wages, and we totally understand that and support that. But a benefits package is wages as well as benefits and then other benefits. So if the state could think through a way to have a substitute pool that allowed people to take time off, that allowed them to seek medical professional guidance, whether it's mental health or other physical health, but not being able to have that paid time off or any time off was forcing people to come to work not in their best mindset and not in their best health. So thinking through a substitute pool that the state is going to be able to manage is something that we are actively pursuing. And then I would just end with throughout this, well, before the pandemic, we decided that we wanted to redesign our quality rating and improvement system. And we decided to keep going with that. However, making some tweaks and changes along the way. And what we focused on is that a little less on the R, but much more on the I, on the improvement. And we realized that many administrators were in a situation where they might have had additional money coming in through stabilization grants, but they didn't know how to make that money work differently than they had before. So a focus on our redesign system includes business practices, really making sure people have a strong foundation on what it is they need to be doing, and as well as challenging folks around leadership practices, reflective supervision, and making sure that we could give them ideas or help them think through some innovative strategies on recruitment and retention. For example, not that this is a new idea, but many programs decided during the pandemic that if they hired someone, they were going to be able to offer free or highly reduced childcare tuition to those employees if they had children. So at one of the job fairs, I heard someone talking about that, and an applicant was amazed because maybe the hourly rate wasn't as high as she wanted, but not having to worry or pay for childcare, she was able to make things work for her. So Delaware continues to be focused on workforce. As we all know, the challenges exist in policy and procedure to get those things done, but we continue to think about different types of supports to get people through this pandemic, and also to keep programs open, because as we all know, if we don't have open programs, we don't have access for children and families, and it becomes a larger issue. So I'm happy to answer any other questions in the breakout. Thank you so much.
Thanks, Kim. I particularly appreciate the kind of broad and creative way that you guys are thinking about benefits for the workforce. The childcare assistance, the substitute pool, and also the telehealth, support, and looking, providing opportunity for the staff to kind of get some, especially social emotional support during these times. I think those are great ideas and suggestions for the field. Thanks. All right, next we have Taylor from Louisiana. Taylor.
Hi, Albert. Thank you for that introduction. As you mentioned earlier, I am now working as a director at Watershed Advisors with some former LDOE colleagues. So we're really working right now to support states develop unified early childhood plans, as well as a portfolio of K-12 work. But formerly, most recently, I was the Deputy Assistant Superintendent of Early Childhood Strategy at LDOE. So I'll be talking about our work there in Louisiana to really support the workforce. So a bit of background on workforce challenges in Louisiana. I suspect what I'm going to share is not different from the context in many of your states. But at LDOE, we had a longstanding partnership, continue to have a longstanding partnership with researchers at UVA, Daphna Basak and her team. And over a period of years, they conducted teacher and leader surveys to really look at teacher compensation across the early childhood sector, as well as measures of teacher and leader well-being. And more recently, they've conducted some research on retention in Louisiana and teacher turnover. So coming out of that research, we now know that about 35% of teachers in early childhood classrooms leave their sites every year. And that rate is actually closer to 44% if you are looking specifically at childcare. So if you filter out Head Start and school-based pre-K, almost half of the early childhood workforce, the childcare workforce, turns over every year. And across a period of 3 years, only about a third of early childhood teachers are still in their original classrooms and sites 3 years later. So we know that the turnover problem is really longstanding in Louisiana. This is not a challenge born out of COVID, although of course COVID has exacerbated this. It's really a crisis that has been in place for many years. And then looking at some of those compensation and well-being indicators from the UVA research, we know that teachers, childcare teachers, make about $20,000 annually in Louisiana. So that's less than half of what their school-based counterparts earn. And that's less than the federal poverty level for a family of 3 in 2020 when that data was last collected. So it's not surprising that we're seeing the level of turnover that we do in Louisiana. Then we look at some of those indicators of well-being. 50% of early educators in Louisiana report being unable to pay for their medical expenses. 40% are food insecure. 30% report difficulty paying rent, and more than 20% report clinically relevant levels of depression. So, before we go into the strategies that Louisiana is using, I think it's important to say that we really tried to understand the problem and are at a point now where we recognize that the reason childcare is even as affordable as it is, which is not very affordable, in Louisiana is because of the poverty, wages, and frankly, exploitation of the early childhood workforce. Some of the measures that were in place or initiatives that were in place prior to COVID that really attempted to get at this problem is a package of tax credits in Louisiana. Some of you may be familiar. They're called the School Readiness tax credits. And one of those tax credits is a tax credit specifically for childcare teachers and staff who are registered in our workforce registry, and then they're eligible for up to a $3,500 refundable tax credit on their state taxes every year. So that's something that has been in place, and that was really the states and advocates' attempt to offer a compensation supplement directly from the state, so not imposing any sort of minimum wage on childcare providers, but really directly supplementing childcare teacher wages. So going into COVID, we know, of course, that COVID has really exacerbated this pre-existing problem in Louisiana and nationally. We heard from providers in listening sessions, in particular, as we were developing our ARPA plan, that the workforce was the single greatest challenge they were facing from the perspective of stabilizing their business operations and getting kids in the rooms, in the classrooms. So we heard from providers that they had a wait list of families and they had available open classrooms, but they literally could not find teachers to hire. And as a result, couldn't fully enroll their centers. Similar to Delaware, we also heard that even those very flexible initial rounds of stabilization grants were being used by providers on the workforce largely. So thinking about ARPA, we really wanted more intentional targeted strategies around the workforce. So one of the things that Louisiana did was create a separate stabilization grant. So Louisiana is awarding one stabilization grant that is fairly flexible, no strings attached, and a separate stabilization grant that must be used to supplement current teacher compensation. And LDOE is not being very prescriptive about how that happens. So we're not saying it has to be a wage enhancement or it has to be a salary increase, but it has to be cash directly paid to teachers, and it has to supplement their current compensation. So some providers are doing this as hiring bonuses, some are doing it as quarterly bonuses or stipends, some are actually raising wages and just enhancing the wages on the weekly or biweekly paychecks. But ultimately, this is getting cash directly into the hands of teachers, which we think is really, really important. In doing that, we're also continuing the partnership with UVA to collect data both at the time of application for this grant on current compensation of teachers in the center and their compensation. And then we'll collect data a few months after the grant to really try to understand the effect of providing ECE providers funding specifically for workforce comp on things like teacher recruitment, retainment, all of those things that we care so much about. Similar to Delaware, we are also doing CCAP eligibility, childcare subsidy eligibility for childcare workers, hopefully as a way to offer them, some additional support and help to recruit workers to the childcare field. And then a couple other strategies that we're exploring right now are some supply building strategies through Louisiana's local coordinated hub model. So we made available some competitive grants for our community networks in Louisiana, who would then use that funding to essentially do a landscape analysis and a needs assessment around the current state of childcare supply in their community, and really try to understand what those gaps are and why there are gaps. And what we've seen initially, and this is probably not surprising to any of you, is that a lot of the childcare supply challenges are really workforce supply challenges. So the barriers for providers to expand their operations are really tied to the barriers around hiring new workforce. So we're equipping those community networks with funding and TA and support to put in place strategies at the local level that we may not be able to accomplish statewide to really target those supply building issues. So they're looking at strategies like community-wide job fairs, offering community-wide hiring bonuses to attract new staff, or other compensation strategies. So we're really excited to see what comes about from those grants, and hopefully we'll be able to elevate some best practices. And then last thing that I would highlight is through both our preschool development grant renewal funding and the ARPA funding, we're funding sub-grants to communities to fund birth through 3-year-old seats. And that was sort of always a plan of our PDG grant, and now we're supplementing that with ARPA. And something that we're exploring right now is whether or not we can pilot a higher rate for those seats if providers who receive those seats are willing to agree to compensating the staff who work in those classrooms at a higher level. So, it's essentially a contracted seats model. So our community networks are working with childcare providers to essentially buy a classroom or half of a classroom of seats. And we're exploring, can we raise those rates And in exchange, say the staff and the teachers in those classrooms must be paid $18 an hour. Or, maybe it's not 18, maybe that's not the magic number, but something higher than what we know they're currently making. So the team at LDOE is exploring that pilot. And I think it'll be really interesting and has some long-term implications for how Louisiana as a state might implement UPK or, expanded funding for seats in the future. I will say that we really took a cue at the state level from New Orleans, who already has a city-funded birth through 3-year-old seats program that they call City Seats. And they're actually doing this with their City Seats program. So the New Orleans City Seats program essentially says to providers, in order to be prioritized for this funding, you must be in compliance with the city's living wage ordinance and pay all of your staff $15 an hour. And then the rates for those seats are set pretty high. They're set, I think, at $15,000 per seat, which in Louisiana is a pretty good rate. And so that's sort of a carrot for providers to increase their wages without putting a mandate in place to do so. We're also exploring, or Louisiana, I should say, is exploring additional strategies, including benefits, whether the state can be a payer of benefits statewide, or even just fund things like healthcare navigators who, support childcare providers and their staff to understand what benefits they're already qualified for. And we're also, similar to Delaware, working on a statewide substitute pool. So I'll be happy to talk about any of those things in greater detail, but I think that's probably a good stopping point for now.
Great, thank you. Sorry, I have to unmute myself. Thanks, Taylor. Reminder that if you have any questions, you can type them into the chat or just come off mute. I think I actually have a question. So I guess this is mostly for Taylor or Kim. Can you guys talk about if your states have done anything to integrate new funds into TEACH scholarship programs or any other type of scholarship programs similar to TEACH? Anything happening there?
I can just add the fact that, yes, we are going to be adding funding to a scholarship program, a statewide scholarship program, really focused on, as I said, helping people obtain a CDA and then making sure that partnerships with our local IHEs are strong so that depending on what route they want to take, things are seamless and articulation is consistent. So we're trying to remove any roadblocks there. But I would say, yes, if we want a highly supported, educated, and compensated workforce, we have to think through adding money to all of those things. And in Delaware, even though we're small, like I said, 2 hours top to bottom, we have quite a few IHEs who provide degrees in early childhood, but it's getting folks to it's getting them in that pathway seamlessly and supported, that intrusive support that I'm talking about, to make sure that they stay on track to do that. So it's a long-winded answer of saying yes.
Yeah, and Kim, does that, just to follow up, does that come with any compensation? Like, is there like a wages kind of program alongside that investment in scholarships?
So that's still being worked out. We hear from our advocacy folks and our partners, our stakeholders, that is definitely something that needs to come along with it. So we're still thinking through how to make that sustainable. As you know, with federal funds, the choice is, give people money now and help them for the next few years, but then sustainability kicks in. We learned our lesson with Early Learning Challenge Grant that some of those services were not able to continue on. Some were, and it's about choices, but yes, it's a priority. It's just, getting through the details of how that's going to happen.
And I would add,
yeah.
Oh, sorry. I would just add that in Louisiana, we already paid for scholarships for any childcare teacher to attend a state-approved early childhood ancillary certificate program, which is essentially a Louisiana branded CDA program that is a state approved program. So we're already funding any teacher to obtain their CDA in Louisiana, and we require it within 2 years of their start date. But what we have not historically done in Louisiana is provide those teachers any sort of stipends or compensation for the time spent in that program. So we say, you know, you must attend and you must complete within 2 years. We'll pay for the costs. But the fact that you're working in the evening and on the weekend to actually obtain this credential, we expect you to kind of shoulder that cost burden. We are now exploring, or LDOE is now exploring some sort of compensation structure to incentivize teachers to work their way through those programs.
Thank you. There's a question from Lori about basically research partnerships, collecting data to evaluate you know, these strategies that you all have described. And Taylor, you know, you talked about your partnership with UVA. So can you, I don't know if there's more to say about like going forward, the kind of evaluation work that you'll be doing. And I wonder if Caitlin, there's anything you guys are seeing at the national level about how states are using data, collecting data around both how to use federal relief dollars and then also, you know, how to evaluate, you know, what comes out of the strategies that states are implementing. So Taylor, to you first, and then maybe Caitlin can weigh in a little bit.
Sure. So a big portion of our first PDG grant, we funded this research partnership with UVA to continue. We're really lucky because the folks at UVA are really, really interested in workforce in particular. So even separate from our funded partnership with them, they're really interested in partnering with us to do some research on our workforce. I think one thought that comes to mind is that LDOE is doing some work to build a longitudinal data system that functions a lot better than what we have now, which is, you know, a bunch of scrappy, different transactional data systems that don't talk to each other. And one of the pieces that that data system envisions is a much better workforce registry for early childhood. So I think even with some of this turnover data that I described at the beginning, UVA has had to be really scrappy in terms of how it pulls together this analysis because we don't have really great workforce data. And so I think as a state, we're very interested in thinking about how can we use some of these ARPA funds to accelerate the development of that longitudinal data system so that we have better and more easily accessible data on workforce in the future.
Caitlin, do you want to add anything to that?
Yeah, first I just want to say thank you, Lori. This is such a great question. Thank you for raising it. Yeah, I was just looking through some of our data to see what information we've gotten, and I think it's striking that we've gotten a lot of submissions from states around what they're doing with the funds for compensation. And then when we ask about like what data are you collecting to identify impact, it's just like crickets. So I would love to hear from folks on the call about what your states are doing. I know that I've heard, at least in Connecticut, not sure if there's anyone on from Connecticut, that you might be about to be doing kind of a survey to understand like how did programs use the money from the stabilization grants and trying to kind of document that use. Generally speaking, though, I would agree with Lori that this is actually really incredibly important for folks to be prioritizing, especially if you're thinking about some of these, you know, interesting pilots like you were mentioning, Taylor, in Louisiana, in your own states. Like really being able to say, here's, you know, what workers were getting before, here's what they're getting now, here's the difference that made in retention, recruitment, is all going to be incredibly important for continuing to make the case that we need to invest in our workforce. So I can't stress that enough. And I would definitely, again, love to hear from you all on the call. What are you thinking about this? Are you building your own research and data capacity?
We have a question in the chat about any infant toddler workforce programs that are being developed utilizing WestEd PITC or 0 to 3 competencies. Not from in Delaware and Louisiana. if anybody, other states in the room have that, have any relevant experience, please pipe in, and maybe this is also could be a small group breakout discussion as well. On the subject of data, Taylor, I want to come back to you because I also appreciate that you guys, in addition to the research partnership you guys have with UVA, you also did what I heard listening sessions with the field and early child educators, which is also a kind of data, more qualitative, and I don't know how systematic it was, but can you say a little bit about that process and kind of what advice you might have for state agencies who are who will be continuing to do these kind of stakeholder engagement, particularly with early childhood educators?
Yeah, absolutely. Happy to share a bit about those. I will say in the early stages of the pandemic and as CARES funding and even CURSA funding became available, we were just moving really, really quickly. We were getting those stabilization grants out incredibly fast. And I'm sure like everybody on the call today in your states, our teams were just really tapped, and providers were completely overwhelmed and really tapped as well. And so we tried, and I think did a fairly good job of really keeping the field informed. We did monthly, at first it was weekly webinars with the field where they could ask questions and get answers to questions sort of in real time. And that was more of almost like an information exchange, where we were keeping them updated and letting them know about applications that were upcoming or changes or waivers to policies, things like that, health and safety issues, all of that. When ARPA became available, we sort of saw it as an opportunity to slow down a little bit because we already had so much CURSA funding. And this was just such a large sum of money that we really wanted to be incredibly intentional and use it as an opportunity to sort of reset the strategic vision for our work and think about how to design initiatives funded by ARPA that we could eventually scale through regular CCDF or state funds or other funding sources. So in late spring, early summer, we conducted, I think it was like 15 listening sessions, and we did them all virtually, of course, which I think actually in some ways made it a lot easier for us. Not entirely sure whether they would have been better or worse attended if we had done them in person, but it was easy for us to have a lot of them because we were doing them from our desks. And they were pretty well attended. Albert, I think you and I actually talked about this. We struggled to get parents to attend. And so I think, family engagement on this front has been something that we've struggled with in Louisiana and really open to thoughts from other states, but providers lined up to participate. We had no challenge getting providers to attend these listening sessions, and they were fairly structured. We went in with, some clear questions that we wanted answered, but saved time for just open discussion and questions they had for us at the end. And I think it was really helpful. A lot of what we heard confirmed what we were already thinking, but certainly new issues were raised. And I think it also meant that when we got to a point where we were releasing our ARPA plan, the field felt really informed and brought along and invested and like they had been part of the process. So that was really important.
Thanks. Tim, anything to add to that? On the topic of stakeholder engagement with early child educators?
Right. I would agree that although I prefer an in-person meeting, and I think a lot of providers or many people do, the ability to do a Zoom or a WebEx has actually increased our attendance in actual just state advisory meetings, or even surveys. It just seems like people want their voices to be heard, and we would send out surveys, prior to COVID with a really low response rate. And we're not 100%, of course, but we've seen an increase in provider voice in any way that they can go. They'll do it online, they'll do a survey, but we definitely have been able to connect. Families continue, I totally agree, continue to be a struggle. How do you reach out to them? What's the best way to involve them in the community? We are in Delaware working with the Federal Reserve Bank to do some research research on the business community impact of childcare, and that's been really interesting. We're kind of really digging into that. We've had 6 listening, or we'll have 6 listening sessions with the business community around the impact of childcare or lack thereof on their businesses, and hoping to make some recommendations based on that group. But there are families, obviously parents in those conversations that have shared their issues and concerns with the lack of childcare. So it's all kind of coming to a head, but I would say online has given us more flexibility, but there are still some groups that are just really challenging to get a hold of.
Taylor, I wonder, I think this question might be directed at you, and Don's question in the chat about did you provide any tax information to the centers and staff that receive funds? I'm assuming this is about the impact on tax liability for providers and educators who are receiving these funds.
Yeah, we tried to, although, I think we were quick to recognize our own limitations and knowledge around those areas. So what we did was we partnered with an organization in Louisiana called the Louisiana Budget Project, who had been producing some research on the cliff effect, when your wages or salary increases just so much that you lose access to public benefits. And so we hosted some webinars for providers around the same time we were making these grants available for the folks from the Louisiana Budget Project to talk about their work and, tips and advice or recommendations they have for how to dole out bonuses and stipends in ways that mitigates those, those unintended consequences. So that was sort of our approach.
Thanks. All right, we're getting to the close of the hour, to the top of the hour. The only other thing I would love to bring up is the fact that there are a number of states that are developing salary scales for early childhood educators, and I believe Delaware is one of those states. And I don't know, Kim, if you have more to say about that, but I wonder if you have more to say, please do. And I want to know from Caitlin whether you want to comment on what the benefit of is in doing these things, so that, because it could be, one can easily imagine an exercise of developing these scales and then it just sits on a shelf and who knows what, because, we can't figure out how to implement it. So wonder, Caitlin, if you have any perspective on the benefits of doing it. So Kim, first, do you have anything any additional information about what Delaware is doing there?
Sure. So this actually was a legislatively engineered. There was a lot of advocacy in our last legislative season to do this. So we are actively involved with a group to look at creating a compensation scale. As you can imagine, there's lots of details and issues with that. We've been very upfront with providers that this will be a suggested scale. We aren't able to mandate it. So, but what we need to do is think about how things like a $15 minimum wage increase is going to affect the scale, and depending on educational attainment, how that's going to affect pay scales down the road. But we're in the very infancy stages of it, but it was legislatively mandated. So because of that, we have to have something in January, and it's going to be a draft, a sort of first draft or phase in, because we obviously would want to get more feedback from people. But it's at this point something that will be a resource to programs and not a mandatory scale.
Thanks, Tim. Caitlin, you want to give the last word on this one? And then we will close out.
I do. I hope you can hear me. I'll talk louder because there's leaf blowers all around right now. So this is something that we track in our early childhood workforce index that we do every 2 years. And we have been so pleased to see more and more states are, as you said, Albert, trying to develop these salary scales, even if they're not required yet, because of course we need dedicated funding to be able to actually implement them well, similar to how states have done that for pre-K. But I think what's really important about it is that it really establishes the goal. Like what we're saying is, regardless of where we are now, we want all of our educators to be educated on par with teachers of older children, paid on par with teachers of older children, to really kind of set like, what are you trying to get to? Because then you can kind of back out from there to say, okay, if this is what we need, where are we now? And then really start to cost model, how much do we need to invest in our system to be able to get all of our educators to, at a minimum, a livable wage. And for those educators that are educated the same as other teachers, to pay them the same as other teachers. So we're not constantly losing great early educators to public schools and even just to retail or, fast food places down the road.
Great. Thank you, Caitlin. So let me just sum up by providing a few sort of themes and sort of lessons that I think I heard from the speakers. I think one is the importance of the need to listen to the providers and educators in these times and really engage them in developing policy solutions. There's so much energy from the field because of the experience of the pandemic and also so much expertise and power in the field that I think it's incumbent upon us to really leverage all of that. I think we need to keep both quality and equity at the center, as Caitlin pointed out in the early part of this conversation. I think because states and programs are so desperate to hire staff that it might be tempting to relax our standards, but that it will only take us backwards. But at the same time, we need to think about how the policies and strategies that we're developing and implementing are affecting the professionals at the margins of the workforce, right? The infant toddler teachers, the family childcare providers, educators with little or no post-secondary education, and maybe immigrant, people from immigrant backgrounds, et cetera. So really we have to be thoughtful about that. And then finally, just to be bold and creative. I know that you all don't think of yourselves as professional advocates, but I've worked with enough of you to know that many of you believe you are advocates at heart, if not in your job title. So I hope that you would be as creative and opportunistic as possible, and really find your allies in your own agencies, in other parts of state government, in other policy and advocacy organizations at the state or national level who can help you create some sort of new roads for change in this area. So with that, I'm going to turn it over back to Mandy, and she'll give us instructions for the next part.
Thanks so much, Albert. Thanks for that summary, and thanks so much to our panelists. I'm so glad this conversation is not over. It will continue in breakout rooms, and they will work similar to yesterday, and I'll give you some instructions on that right after our break. So now's the time to get a little break in, refill your coffee or beverage that you need, and we'll see you back here at 2:15 Eastern Time. Thanks, everyone. For our breakout room, we'll come straight back after breakout rooms to do our State of Preschool yearbook session with our friends from NEAR. So as a reminder, if you did not join yesterday for the breakout rooms, how this will work is you'll get a chance to go into a breakout room with one of the panelists to hear more about their state story or their national story, if that's the case. And there will be a facilitator in each of your breakout rooms. One of our dedicated program committee members will be your facilitators. We'll also I'll bring you all back together around 4 to continue our main plenary sessions. So at this time, I'm going to go ahead and open the breakout rooms, and you should see on your screen the option to join one of the 3 presenters' breakout rooms. So please take a moment to make your choice and let us know if you have questions, and we'll see you back here in just a little while. Thanks, everyone.
Krause Friedman, and I think I saw Benji sitting on Allison's lap a minute ago, which is terrific. And Karen Garver, Kate Hodges, Beth Gardner, and our newest member, Tracy Jost. Some of you might also recognize as being former state members of the organization. We will begin by hearing from Steve Barnett, Senior Co-Director and founder of NEAR, followed by a facilitated conversation with the Rhode Island team on how they use the yearbook and its data in their state. Then we want to hear from you. So we're going to go to breakout rooms in a little while, and we have some questions for you, and I'm sure you have some for us as well. So as you can imagine, we have a lot to cover. So I'm going to also be the timekeeper. So hopefully we can move along and get to everything we'd like to, but I want to thank everyone for being here and being part of our conversation. Okay, Steve, I'm going to hand it over to you.
Great, thanks, Gigi, and keep me on time. I'm going to try to blaze through this, but that's not my my strong point. I'm a slow talker, so I just wanted to apologize in advance for any of you who are intimately familiar with the yearbook, which may be most of you. I want to do just a brief coverage to make sure we all start with the same understanding of what's in it. Just talk a little bit about how it's used, and then we'll move into our more detailed discussion. So just to start off with the state of yearbook, what it is and how we use it. Next slide. I think you all know that it's organized into three main components in terms of the concepts. One is enrollment or access. The other is quality, with an emphasis on 10 benchmarks for minimum quality standards. And the third is spending or funding. Now, for any of you who filled this out, you know there's a ton of other information. There are literally hundreds of questions. So this covers everything from eligibility and program availability to schedule, curriculum and learning standards, the extent to which mixed delivery system is used, and then special topics from year to year. This last year, special topics include early childhood special education, dual language learners, and the impacts of COVID-19. One of the things we've tried to do is to be a little more real time during the pandemic, because the impacts have been so dramatic and so fast that we wanted to provide accurate information about what the impacts of the pandemic are on programs. Next. So we present this information in a variety of ways in the yearbook and in our media work and dissemination inside and outside the field. There's both an inside the field information flow and an outside the field to the more general public, policymakers, media. We do this at both the national level and individual state levels. So as you can see, and I think everyone is aware, growth in state preschool, while it's been impressive in some respects, has also been quite slow. And the last few years really has kind of stalled out again. You can see most of the growth is for 4-year-olds, not so much for 3-year-olds. And every year we present this from a national point of view as well as from a state perspective. Next slide. Right, so, and of course, enrollment and provision of state-funded pre-K varies dramatically by state in terms of the percentage of children enrolled, from essentially universal to none. Right? I mean, that's about as big a range as you can get. And we try to present that from a national perspective in ways that highlight differences among the states, that allow people to make comparisons both to the rest of the country and to near neighbors, right? So if you're in Florida, Georgia, and Alabama matter more than, say, Maine and Washington. And one of the ways we do that is presenting information in maps. You can see this is the map for 4-year-olds. Next slide. And I want to give an example now of, I mentioned Florida. What would this look like at the state level? So this brief example, just we present information. I think you all know the state profile pages, but beyond that, the idea is to capture what is the state of Florida's preschool program, and to move beyond that, to provide this information and some additional information in ways that can be used to push the agenda on what can be used to improve it, right? The one way of thinking about the yearbook is as a tool for advocacy. that's not just advocacies outside of state government. Those are, they're obviously important. It's also for advocates within state government. And those of you who are state early childhood administrators are perhaps the most important advocates of your programs within state government. Okay, so we start with these two questions. Next slide. So the data on enrollment in Florida provide some insights. You can see Florida was up at one point to 80% of children enrolled. That started declining, right? That's an element, that's an element that can be used then to advocate for the program, as well as to advocate for some work to try to understand, why is enrollment going down? Why would we go from 80% to 72%? Next slide. We do the same thing for spending, right? So you can see on this chart, spending in real current dollars, and if you go back to the origin of the program, was about $3,200 per child. That's declined relatively steadily, a little bit of up and down, but in 2020, just $2,400 per child, right? So one way of thinking about how to use this data is what's happening to us compared to ourselves. Another way is what's happening to, how do we compare to other states in the country? Florida has one of the 5 lowest per child rates in the nation. You can put a dollar value on the transition from the Great Recession to present, almost $1,000 per pupil, given the low level at which Florida started. That's a lot of money. And then we also provide estimates of what's needed for a high quality full day preschool program with salary parity in every state based on that state's education costs, cost of living. And in Florida, that's over $11,000. So you can see just how big that gap is in Florida. Right? We provide that same kind of information for every state. Next slide.
We have about 1 more minute.
Okay. Here's another way that we present information. If you look at the rankings, Florida ranks 4th in percentage of 4-year-olds enrolled. If it had stayed at the 80%, it would rank 2nd. It ranks 43rd out of 45 states in terms of per pupil spending. Next slide. Okay. We also present the benchmarks, of course. Sorry about that. Somehow I have a hornet in my house. So you can see clearly here a comparison of Florida. How many benchmarks do they meet? Why do they or do they not meet them? Next slide. This again provides a way of comparing to other states. Green is go, red is stop or danger, if you want to think about it that way. You can see how Florida compares to its nearest neighbors. When we present this information and others do in Florida, even people in the system are shocked. Right? So you might think everyone knows this information because, of course, it comes from you and you know it well. But it turns out even people you might think of as experts in your system don't necessarily know these things. Next slide. Right. We have something called the cost of preschool quality and revenue tool. It lets us calculate, for example, in Florida, how much it would cost to implement each of the benchmarks that they're missing. And you can see some of these are very inexpensive. Some of them cost much more money. Provides an additional ingredient for people to use in terms of advocating for program change, because it's an easy tool to use to tell your policymakers, well, here are 3 things we could do. We could get 3 more benchmarks. It would cost us less than $3 million a year statewide to do that. Okay, next slide.
Thank you, Steve. And I think we're going to hand it right over to Allison. We'll introduce the Rhode Island team.
Thanks, Steve. So now we're going to turn to the next sort of segment of our hour, and we invited Leanne and Lisa from Rhode Island to talk about how, from the advocacy perspective and from the state perspective, they've used the yearbook data. So I will introduce them briefly, and then we'll jump right into our conversation. And Mandy, if you want to take maybe the slides down so we can just see them a little bit bigger, we can do that for this. We don't really have any slides. So Lisa Nugent, and I apologize if I'm pronouncing your name wrong, is the Early Learning Coordinator at the Rhode Island Department of Education and has served in that role since 2016 and really overseen a lot of expansion in the state. She comes to this role with a strong background in childcare, having worked her way up from a teacher assistant to the director of a childcare center to operating 15 centers throughout Rhode Island and Massachusetts. And she misses working directly with the children, but she received her master's degree in adult learning and instructional design from St. Leo University and is passionate about creating policies and systems that benefit not only the children, but the teachers that do the work each day. So we'll be hearing from Lisa shortly. And then Leanne Barrett works every day to improve early childhood policies statewide, birth through age 8. She's the coordinator of the Right from the Start campaign, a state campaign to advance policies that help young children and families in Rhode Island. She's also the coordinator of the Governor's Early Learning Council. And Leanne has spearheaded the development of Bright Stars, the state's quality rating and improvement system, managed the state's pre-K exploration and design process, and was the director for the state's first evidence-based home visiting grant. She works to increase childcare funding, particularly to improve wages for childcare educators and to expand the childcare assistance program to serve more families. She has been a strong advocate to establish Rhode Island's paid family leave program and earned sick leave policies. And prior to joining Rhode Island Kids Count, Leanne was the vice president at United Way of Rhode Island and the program manager at Work Family Directions. She has a bachelor's degree in developmental science from developmental psychology from Brown University and a master's degree in child and family policy from Tufts University. And she's also endorsed as an infant mental health policy mentor. I apologize for that. And with that, I will stop talking and I'm going to throw out the first question. If Leanne, if you could start by telling us a little bit briefly about how the yearbook has been used in Rhode Island, especially by the advocates.
Thank you, Allison. And I apologize for how long my bio is. I think because I work on so many different issues, I just keep throwing stuff in there and it's gotten really long. But anyway, I just wanted to say that how incredibly valuable NEAR and this preschool report have been and go way back. So I've been in the field for a long time, but we in Rhode Island were first really made aware that we did not have a pre-K program when NEAR put out a report saying that we were in the dirty dozen or the 12 states that were in the pre-K wilderness. So we were among states who did not have one. And I spent about 1.5 years working with our state's childcare administrator trying to convince NEAR that our childcare program was pre-K. And they kept saying it's not, you know, as long as it's connected to work status and some other reasons, you don't have a pre-K program. So we decided that we were going to look into this and look at what other states were doing. And we formed an exploration team and NEAR helped us all along. So we benefited from other states in knowing and from the analysis NEAR was able to give us and those 10 initial quality benchmarks that were available in 2007 and 8. So we designed a pre-K program based on the learnings of everyone else to meet all 10 NEAR standards from the very beginning and have salary parity, and to be built on a mixed delivery system with childcare and Head Start at that planning table from the very beginning. And when we rolled it out, it was probably about 70% community-based programs. So it's been really helpful. And we continue to look forward to the yearbook's release every year. And we continue to advocate very strongly to maintain our 10 quality standards and very hard on salary parity, which we're slipping on. So I like that NEAR tracks that, and we're getting a little bit away from what our original vision was, and that is not in law or regulation, which probably means I need to do something as an advocate. and to track access. So we have very high quality, very low access, but we continue to be very strong as advocates, saying it is a lot easier or better to expand a good program than to have a very large program that's not very good, that you're spending a lot of money on, that's not having the outcomes it needs to have. So we very much focus on quality, and then really want to see need the funding to expand access. And can I say one more thing, which is that the funding amount per child is very helpful. We have a very high funding amount because of the quality standards and because the wage parity. We have very high targets in our elementary schools, and that is helpful. But what's really helpful is the funding amount we spend on K-12, because sometimes it's not helpful for policymakers to think, oh, well, we spend more money than most other states do. What can I do to save money? But we can compare it to the K-12 spending amount per child, which is in the near yearbook for every single state. And we continue to say, well, we should be spending even more than we're spending right now if we really want to attract and retain effective early educators in the program. So I will stop with that.
Great, thank you. Lisa, do you have anything to add about how the yearbook's been useful in your role?
So I always need more money. So, but I will say to Leanne saying that we wait every year for this to come out, for those of you on this call who actually fill this survey out, I have the sweats before this comes out, even though I'm the one who's putting the information in, because we were very lucky in the fact that for once a state team did not build the plane while flying it. And so we used the near benchmarks as those guidelines to build the plane. But now I have inherited a program that I have to hit all 10 benchmarks no matter what. And what's fantastic about that is we use it inside state agencies, because it's all of a sudden someone's like, well, we could save a little money if we did this. We immediately hold up our benchmarks and say, sure, you're going to slip till 9. Do you only want 9? And we're going to take away that prestige. And we've really been focusing on the access piece, so last year we were only at 32 in the country. So now it's well, where are we going to get a little bit further to get more access in? And I think that ability to use this yearbook with our politicians, with our senators, with our legislators, with the state government who maybe doesn't always understand early childhood. So why only 20? If I go to 25 kids in a classroom, I'm going to get more access. You're going to have teachers run screaming from the building, because 25 3 and 4-year-old is absolutely insane to manage. And I think that's what I've really tried to bring to this yearbook. We make a big deal about it. We make sure that everybody knows it's coming out. We make sure that they know where we stand when this yearbook comes out and how we're measuring up against other states. We are always in competition with Massachusetts. It's just the way we are. And so we really do use this on a pretty much weekly basis when we're continuing to build. We are heading to universal pre-K. We know with this administration that's coming in, we're hoping to get more funding, and we're looking now at how do we get those 3s in, but how do we do it the right way and not just open up access and lose that quality piece. So it's that blend that really helps us to kind of move everyone forward in that early learning space. And we have these guardrails that really can keep us honest, and they're in black and white. We have something that we can tangibly hand someone and say, look at where we are and look at where we need to go. And so it has been phenomenal for me, who came in trying to continue the work that was done prior to me getting here and keeping it moving forward. Because if it drops below 10, I don't know if I'm still employed. Leanne will run me out.
Well, thank you. You both sort of touched upon this already, but what do you think are the most important impacts that the yearbook has had on building and supporting preschool in Rhode Island? Is there anything beyond what you've already said that you want to add to that, either Lisa or Leanne?
I would just say from a state perspective, the benchmarks are fantastic, and we want to hit 10 in all of the early learning pieces. But as a state employee and trying to push this program, it is truly the financial impact that I can get out of using this data, and how I can push people to my way of thinking, which is we need more money and we need more access. And I always need more money. I'll take more money from anybody. We're really committed to the mixed delivery system. And I think that's something that when I came on, because I had a childcare background in private childcare, I wasn't a public school employee. So I'm more committed to making sure we stay to that mixed delivery system. And so that's really what I treasure when it comes out.
Leanne, do you have anything to add to that?
Yeah, I would just, again, probably say, so Lisa is an awesome state administrator and partner on the inside. And she knows like the role of advocate sometimes is to push. But what has been really great is the data in the yearbook about the mixed delivery systems. And when we were designing it, we felt pretty confident based on some other states' positive experience that it could be done and that we should try to do it. And that the community was further ahead than most school districts, particularly Head Start, was already delivering high quality stuff. And then in the early days when we had a really small program, the Department of Education learned that it actually could be higher quality, easier to work in community-based settings, which is one reason they hired Lisa. So they felt comfortable like saying, oh, people in childcare actually do know what they're doing when it comes to high quality early learning. And so we're excited to have Lisa, and all of the pre-K classrooms are really excited to have her overseeing it and learning from it. So I'd say diverse delivery has been really supported by the data in the yearbook, and the continued belief and data that comes out in the other yearbook you guys do on Head Start has been very helpful about making sure people know that Head Start is the original pre-K program, and that it's a slightly different model than our RA pre-K program, but it's still very high quality. And there's different things we need to work on for Head Start, but it's another comparable parallel program to our state pre-K program. And Lisa does an awesome job of integrating it. So we have blended and braided funding for Head Start and pre-K now, which Lisa could do an entire another workshop on.
Maybe. It's a hot topic these days. So
I will pay you for your kind words later, Leanne. Thank you.
Do you have any specific examples of ways that you've shared the yearbook data with others in your state?
Well, I could, I know when Deborah Guest, who was, I think she's now in Oklahoma, but she was our state administrator, and she came into Rhode Island when we had a very small program, and she came in thinking, what is wrong with Rhode Island? Like she had seen the yearbook and was like, why do we have such a tiny little program and we're not doing as much as other states? But it made her realize like the quality was where we had decided to start with. So we've been successful that in going across administrations. We had someone before Lisa who was in that role. We have different commissioners, we have different governors, we have all kinds of people who continually have basic fundamental questions of, including a legislator who said to me, we have a pre-K program. And I'm like, oh my God, yes, we do. So there's still, like, as Steve said, people who, we have a brand new governor as of March, and just, educating him about all of the work on quality and how there are a set of national standards and that we have a good program. We just need to expand it. It's just really helpful. And our previous governor, she wanted to do a little bit more access. So the guardrail of having 20 kids in a class size was helpful because we had designed ours to be 18. And the initial ones were 18. And she, was like, well, why can't we do 20? And I was like, okay, that's fine. I'm not going to fight you, but you can't go over 20. Like if you propose 25, like Lisa said, the advocates would write op-eds and we would say, oh, you're not going to meet all the standards. And
I think we're short staffed now.
Right. So it's so anyway, so I think that's just more examples of just bringing it into those individual conversations you have with new decision makers who are continually appearing out of the blue at times and need some basic understanding within the context of the nation.
So my favorite story is with our last governor, we worked with her chief of staff. So Rhode Island does not have a Department of Early Education and Care. So we have DHS that is licensing NRC CAP vouchers, and I sit at the Department of Education, which primarily runs the RI pre-K program. But again, we are super committed to this mixed delivery system. So we actually formed, which is like a unicorn, a cross-state agency governance team that is DHS and the governor's office and the Department of Education. And we all work very, very well together. But I remember being in a meeting and somebody at DHS was like, well, let's talk about the bachelor's degree, because we have a lot of great teachers who are 4-year-old teachers working in community-based centers. And I think we could lower that requirement. And the chief of staff picked up and he's like, near, no, I'm sorry. We are not going below a bachelor's degree, which showed us that he paid attention, right? And he was understanding it. Now, what that did lead us to do is we are starting to build for those teachers in our workforce a pathway for them to get to a bachelor's degree. Because I was one of those people who worked full-time and went to school part-time and couldn't get a PK to 2 certification because I couldn't afford to student teach because I worked full-time and I couldn't quit my job. So the adjunct pieces that this yearbook can push you to, of now, how do we build this pathway for these phenomenal teachers who have been working with 3- and 4-year-olds for years to get to the matching education level that they need to raise their pay, to absolutely showcase them as the professionals they are. But he was just a riot. He's like, nope, near, sorry. And he shot down a head of state government so fast that my head spun. It was fantastic.
Well, thank you. We're almost out of time for our little session, so I wanted to just throw out one more question. If you have any, like, one last piece of advice for other states about how to use the data, how it's worked for you, recommendations for them, so that they could make the yearbook as useful in their states as you've done in Rhode Island.
Make it a big deal. When that embargo stuff comes out and you start kind of putting that whisper in everyone's ear that like, this is where we are, make it a big deal. But again, data only works if you use it. So you have to continually, in your presentations that you're doing out in your communities and in your own advocacy work, continue to refer back to this yearbook. And so they realize the breadth and depth of the data and the work that has gone into this that we can share with the entire state.
And I'll just interrupt before Leanne goes, if she wants to, that if people are using the data like that, and there's ever a way we can be helpful to make graphs, to get you different data, to run it in different ways, please reach out, because we want to help you make it useful. And we may talk about this later if we have time, but we're trying to get a better website together over the next year or so to make the data more useful, more readily accessible. But in the interim, feel free to reach out if there's ways we can help to make it more useful to you. Leanne, if you want to add anything.
Yeah, and NEAR has been an awesome partner with us all along. They've come to Rhode Island for important meetings on various occasions that have been really helpful. And I would say to you guys who are all state administrators, I think, to work with your external advocates. You know, there are a bunch of them, and if you organize meetings with them, I often find that they have a lot of really good ideas, and they are not able to influence policy many times directly. So I have my little friends in state government who are like, call me and be like, you need to do this, or you need to stop that. And they can't do it, but if you pick a few things and you are persistent about it over many years, which often crosses multiple governors' administrations, you can change things for the better. You just have to find friends and colleagues on the outside who will work side by side with you to move things forward.
Great. Well, thank you. I hope this was helpful for everyone. And thank you, Richard, also for your comments in the chat. I didn't get to read them all super closely, but we know Michigan's doing a great job using the yearbook data as well. So I want to, we're going to switch over now to some small breakout groups. And I want to just, before we do that, again, like highlight that NEAR really sees the yearbook as a partnership between us and all the states. We want to make it useful to you. We know it's a huge burden to fill out the survey every year, and we are eternally grateful for all your hard work doing that. But please think of us as a resource. We are a resource. Reach out to us if you have questions, wherever we can do to be helpful. If you're getting requests for the same information that you just entered into the survey from other people, send us an email. We can help you respond to those people so you don't have to do that. That was one of the original purposes of the yearbook survey way back almost 20 years ago now, was that this should be the only survey you have to fill out clearly that's probably not reality, but to the extent that we can help with that, please use us as a resource. And so that said, we're going to switch over to small breakout groups. And the goal of these is to really talk about messaging of the yearbook in light of COVID. So we know in a lot of states now, I know Rhode Island is an exception to what I'm about to say, but in many states, enrollment declined, maybe funding was stable, maybe funding is even larger, even higher. And so it's going to look like per child spending is blowing up, is really high. So we want to talk to you about ideas of messaging that when we are coming up on the yearbook release in March, hopefully. And then also thinking about policies, our benchmarks, right? We know a lot of waivers were put in place due to COVID. Our thought right now is that we're going to base our benchmarks for the 2021 school year on policy, not on waivers. We'll talk about the waivers in our supplemental section, but we really want to focus on policy because the benchmarks are about policy. But we want to hear from you. We want to have conversations about that. So that's really the goal of those sessions. And Gigi, if I forgot anything, or Karen, please just chime in. But otherwise, I think we should just head to our breakout groups whenever. Yep. See you there.
Hey, Mandy.
Uh-huh.
Would you be able to pop me into a group so there were 3 of us from NEAR in that one?
Whoops.
No,
Which one were you in? Do you know? Was it Allison? You were in 2.
I was in the one with Gigi and Beth.
Gigi and Beth. Okay. Okay, move you to. I can move you to number 3 with Steve. Does that work?
Sure.
Okay,
All right, Steve.
Here you go.
Yeah, and I just left that one because I didn't want to be on the same one with Steve.
Oh, good point. This randomization didn't quite work for us.
Well, it's kind of hard to randomize for people who live together.
Right. Okay, I'm going to put you in number 1 with Gigi.
Okay.
And Mandy, sorry, my computer froze when you sent us out to groups. You can send me wherever. This is Caitlin talking.
Okay. Hey, Caitlin. Let me find you on the list here. Okay. All right, here you go, Caitlin.
Thank you.
You're welcome. Okay. Lauren, you want me to put you in a break? Let me message you because you're actually doing something else. It looks like. Okay. Let's see. Okay, she's good here. Perfect. Okay, Robin. Oof, that worked.
Oh, wait a minute, Michelle's back.
Uh-oh.
Oh no. Oh.
Okay.
Katie.
Katie, do you need help moving to a different room?
Yeah. Can you move me to breakout 1? Gigi's our state person now. State liaison.
Okay.
Thank you so much.
Okay, I'll put you in her room. She's in room 2, so I'll move
You're
you
great.
right over.
Thanks.
Okay. Did that work? Did you get a message?
I got room 2.
Okay, that's where she is.
Oh, she's in 2?
Yeah,
Okay,
she's in
thanks.
2. Mhm. Let me answer this message real quick.
So Erica signed off for the day?
Oh, I guess she did. I didn't.
Yeah, I don't see her anymore. She might have had to, maybe with
Yeah. one of those
childcare or
conflicting-
something. Yeah, I think we're good.
Yeah. So after this, they just come back. I'm trying to see what slides are left here on theirs.
Mhm.
Oh, it looks like they just are going to talk about the timeline.
Okay.
Yeah, that's it. They only have one more slide.
Okay.
Actually, I guess I should message one of them and figure out when they want to come back.
Okay. I was like, this is like a little near staff meeting. There were so many of them popping on. I know some of them obviously, but
Yeah, it was a lot.
a lot of people. Okay.
Most of them like
Go ahead.
had paid membership too.
Oh, really?
Yeah, to come to the whole thing because they wanted to listen in. So that was good.
Okay. Okay. We're almost done with day 2.
Almost there. So exciting.
I know.
Anything we need to chat about real quick about the icebreakers?
No, again, those are very, some of them, they're so simple, basic, no, I mean, I don't think we need them, I really thought today is the one with the retirees, right? So.
Yeah, if they come, hopefully they,
I
because
know.
Jim had a conflict, Jim Squires, which would have been perfect.
What about Let's Go? I saw him earlier today. I admitted him from the waiting room.
Yeah, I haven't heard from him if he's.
Okay. And then, well, we had Ellen and Lindy already. Is there anybody else? Oh, Deb Adams. I saw her.
Oh yeah, I did see Deb today too. So maybe if Deb joins, or even Richard Lauer, he's been a member for a while.
Okay.
Or Harriet registered, Harriet Egertson, but I wasn't sure if she was gonna be able to come.
Okay.
So that'd be good if she came in.
I don't know that I saw her today, but like the name doesn't ring a bell. That doesn't mean that she didn't.
Yeah, I don't think I saw her today either. Sorry, just answering.
We, like I said, they're just backups, in case we need them, but I don't know that we necessarily do. So.
Yeah. Sorry, just sending that message back to me. Just that's about the near part of the near presentation. So yeah, maybe we could
wait a
just.
minute, we're recording.
Oh, whoops. Okay, I'll have to slice this.